Kat, if you're there.
Hi, Amanda. I'm sure
There
it's
you
quite
are.
difficult to see me with all these people.
That's wonderful. Thank you so much. So I'm going to introduce you to Kat. Kat is a physiotherapist working in a local trust, and she will introduce herself more. But what's really, really important is we're only aware of a really, really small number of AHPs that have actually gone through the ECP apprenticeship. Actually, I'm only aware of 3, 2 physios and 1 OT, and it's been a privilege to talk to the physio and the OT and to gain loads of information about what was good, what was really useful, and actually more importantly, the impact doing an ECP apprenticeship has had on taking that forward. So I'm going to let Kat introduce herself, but Kat is a clinical lead physiotherapist in an acute medical unit at University Hospitals Dorset. And Kat, I will hand over to you.
Okay. Right. Hello, everybody. So I started my Enhanced Clinical Practitioner Apprenticeship in October 2023. I am a clinical lead physiotherapist for one of the inpatient acute teams at University Hospitals Dorset. And then the area that I work on is the acute medical unit. So I work on AMU. Next slide, please. So I'm just going to talk a little bit about my ECP journey. And firstly, why did I choose ECP? So I was sort of at that point in my career where I wasn't really sure what direction I wanted to go in, and I'm still not sure what direction I want to go in, if I'm completely honest. But I spent a lot of time looking at the ACP pathway and had quite a lot of discussions with colleagues that had been through the process and that were now actually in ACP roles. And I just found that I wasn't really sure whether it would be a route that I would want to go down, because it seemed like the colleagues that I spoke to, their ACP roles seemed like quite a generic role based in areas like ED, and they sort of, it felt like you sort of lost your identity a little bit as an AHP, so as a physiotherapist. And so my line manager at the time sort of mentioned the ECP course and said, you know, this is a new course. It looks like it might be quite good for you. So I had a little look at it, and it looked like that I could also maintain my role as a physiotherapist, but also gain some enhanced skills as well. And so the other reason I looked at ECP was I was also looking for an opportunity to do some level 7 study as well. And a lot of the modules in the ECP program that I chose were quite relevant to AMU and my leadership role as well. Next slide, please. So looking at the benefits of doing an apprenticeship, rather than just sort of doing like a master's degree or a master's module, there are some similarities. So obviously you have the support of the university, but when you do an apprenticeship, you also have the support of a workplace mentor. You get the opportunity to do off-the-job training, which I'll talk about a bit later on. You're able to work and train at the same time, so you don't need to be taking any time off. And also, you know, it will give me the opportunity in the future to also help others going through apprenticeships themselves as well. Next slide, please. So a little bit about my course structure. So as I said previously, I studied at level 7, and so the modules that I did were enhanced assessment skills for clinical practice, clinical reasoning and decision making in enhanced clinical practice, and leadership and change in Enhanced Clinical Practice. And for each of those modules, you had an assignment which you had to do and had to pass. And then at the end of it, you had to do an endpoint assessment. So for at the end of the apprenticeship, you had to do a project proposal, which was 5,000 words. And then you had to do an endpoint assessment where you were asked questions on your project proposal. And then you also were assessed on your knowledge, skills and behaviour with the use of your portfolio. So I will talk about that in a bit later on as well. Next slide, please. So a little bit more about off-the-job training. Off-the-job training is really important. And also, if you lead quite a busy life, like myself, I have 2 children, and I also obviously work at UHD. So it's really important for me to make sure that I have that time to study and I have that day set aside so that it doesn't impact too much on my work-life balance. So really important that you negotiate a day with your employer. Because it's part of the apprenticeship, you are entitled to 1 day a week for the ECP apprenticeship that I had undertaken. And it's really important that you make sure that you take that 1 day a week. Sometimes that day a week would have been taken up by what we call direct university delivery. So this is where you go into uni and you have face-to-face lectures. And so with the apprenticeship that I did, for one of our modules, we were in every single week. But then for a couple of the other modules, it was every other week. So we had 1 week at uni and then the other week was a study day. For off-the-job training, basically with apprenticeships, you can tailor them to your job role, which is really, really great because you know your job role more than anybody else, and you know what skills you need and what skills that you need to develop in order to achieve your enhanced practice. So you can organise and decide what you want to do in your off-the-job training. So it could be things like shadowing specialist teams, it could be attending conferences or study days, you could be presenting at conferences or study days as well. It could be writing reflections, and it also can be used for preparation for assignments as well. Next slide, please. So, as I mentioned earlier, it's really important that you have the support of a mentor, and having a mentor throughout your ECP journey is really, really vital. It's really important that you pick the right person as well, because you're going to spend quite a lot of time with this person, and they will be the ones who are signing off quite a lot of your work as well, and will be signing off a lot of work that you put into your portfolio. With your mentor, so I had regular meetings with my mentor every 2 weeks, and in these mentor meetings we discussed things like our plans with how I was going to achieve my knowledge, skills and behaviours, what evidence I could use to put in my portfolio. And also they would then provide me with learning and development opportunities as well. So, you know, opportunities to speak at conferences or study days and things like that. And they also provided wellbeing support as well, because as you can imagine, it could be quite stressful at times. So it was important to have that person there that you could talk to about things. Next slide, please. Tripartite meetings are also part of the apprenticeship. So this is a meeting that occurs every 8 to 12 weeks, and this is attended by your mentor, a representative from the university, so it's usually one of the lecturers, and yourself, obviously. And in these, we discuss our progress review. So basically, with every apprenticeship, you get a list of knowledge, skills and behaviours KSBs, and in each of your progress reviews, you have a table, and you sort of rank how high you are in that table. I think it's something like 1 to 10, and you have, at each progress review, you should be seeing progress where you are increasing in that number. And what you do in the meetings is you sort of discuss opportunities and ways that you can increase your knowledge, skills and behaviours. And at the end of it, you end up with an action plan, and then you have some goals set for the next meeting. Next slide, please. So looking at the benefits of ECP, it provides an alternative progression route for allied health professionals, because often, sometimes, particularly depending on where you are in your career, sometimes it can be quite static. So it's kind of looking for those opportunities. It can also be really helpful for employees. It can help to upskill your existing staff. I belong to the Society of Acute Medicine, and so the SAM, and actually within our SAM competencies for AHPs working on AMU, I don't know if they probably haven't realised this, but they have got a section for enhanced practice as well in their objectives. So they've got their general objectives, and then they've got those higher level objectives that people can achieve as well. So it's really a good opportunity to kind of work with them and use those objectives to try and upskill our staff and give them that status of enhanced clinical practice. It also allows you to maintain your profession while working within an extended role. And particularly for me, it just increased my confidence with my assessment and clinical decision making as well. Because working on an acute medical unit, we do see a variety of things if anybody works in acute medicine. And it can be sort of quite overwhelming at times trying to figure out what's going on with everybody. So it's just sort of, it's given me that extra kind of knowledge, and that it's taught me a different approach to how I approach assessment and clinical decision making as well. Next slide, please. It can help with staff retention as well by providing those opportunities for personal development. And again, we talked about having a more skilled workforce. It also benefits the patients, because it means that the patients have got access to us as ECPs who have that specialist assessment and treatment skills. And it also helps with the coordination of care and through therapeutic planning, which helps to, especially in my area, it helps to facilitate early discharge, or helps with assessing and treating patients in SDEC and preventing admissions onto the ward. Next slide, please. So thinking about ECP and the 10-year health plan. So in my area, it would be looking at early assessment and prevention in our SDEC. Sorry if that's a term you're unfamiliar with. It's our same-day emergency care. And have patients having access to specialist services and a healthcare professional. Next slide, please. So what does the future look like? Well, hopefully it looks like more AHPs looking for enhanced or extended roles within their area, and the ECP programme would help with developing this. It provides also alternative progression routes as well. So especially within my area, most AHPs would be looking at going down the ACP route, whereas now we can look at ECP and our role within that area. And so on AMU, what I would like to be looking at in the next few years is developing a progression route for our AHPs in acute medicine, and looking at the different pathways, including the ECP pathway, looking at our existing AHP workforce and upskilling, them. And also looking at succession planning as well. And hopefully looking at developing a more specialist ECP role within our SDECs. Because a lot of my colleagues here will probably recognise that this is getting more common, and that SDECs seem to be propping up everywhere at the moment, and they are perfect for an ECP to be within that area of practice. Next slide, please.
That's the end of your slides, Kat.
Oh, perfect. All right.
That's great. So I just
wanted to say that if anyone's sort of been thinking about it, or has any doubts about it, or is really worried about, you know, the workload and that kind of thing, I totally understand your worries, because obviously, I said before, I have quite a busy life with working and my 2 children, and it's really important that you just be really, really organized with everything. As soon as you know what your assignments are, and as soon as you can start collecting evidence for your portfolio, just start doing that like straight away, and using your off-the-job study time as well to catch up with anything that you might need, and you can use that for assignment preparation and that kind of thing. So don't let it put you off, because it's definitely been well worth it, and it has been quite a stressful journey, but it's really been well worth it. Thank you.
Thank you, Kat. That's fantastic. And we'll look at some of the questions if you've got time and you're okay to answer a few of the questions that are in the chat for us. One thing I just wanted to ask you was around, we know that you did your course before the AHP schema and model curricula came out, and it was more of a sort of multi-professional offer. Were there any challenges with that, with regards from a physiotherapy point of view?
Yes, so it was very much based on the medical model, which was very familiar with my nursing colleagues. So sometimes there was more of like a medical focus, especially in terms of the clinical decision making and assessment modules. But it was good as well, because I got to meet other sort of professionals other than AHPs, so there were benefits to that as well.
Definitely, and that's why universities have got that ability to build their programs as to what their workforce might need moving forwards. And we know now, you know, even today, we've just learned that we've got this 11th AHP schema that we can now look at for the future as well. So that's really, really good. There's a question in the chat around mentor and supervisor, and just asking about whether you had the same mentor supervisor. Were they the same person, or did you have different ones?
No, they were the same person. I know for other apprenticeships, because I was one of the project managers for the level 6 degree apprenticeships, that they do talk about having a supervisor and a mentor. But actually, when I did my ECP apprenticeship, I just had my mentor, and I guess they acted as both my mentor and my supervisor.
Wonderful. And there's a question in the chat around, is there any examples you can give as to how your clinical practice has changed since your apprenticeship?
Oh, that is a good question. So I think a lot of it is to do with it's probably more to do with my clinical decision making, and it's kind of increased my confidence sort of when I'm ordering like tests and investigations and scans and that type of thing. And you also, because the medical staff know that you have that qualification now, they sort of trust you more, if you like. So they're like, oh yes, okay, yeah, we'll get a scan for them, or we'll do this, or, you know, whereas before you kind of had to fight your case a little bit before they would sort of before they would be like, oh yes, yeah, we probably do need to scan this person.
Wonderful. And there's a question about sort of on reflection. You mentioned reflection a lot through your course, but on reflection now, would you say that you did the ECP course at the right time in your career?
I think I did do it at the right time in my career. I would recommend it to anybody who is looking to progress. It's quite good for if you're sort of a really sort of specialist band 6 looking to progress to like clinical specialist or like band 7 roles, because it my course, and I'm sure it's quite similar to the AHP course as well, gives you, although it gives you quite well-rounded skills as well. So even though you will have like your clinical skills, but it also, one of the modules was about project management and leadership as well. And in fact, I think I enjoyed that one the most. That was really, really good. And it gives you lots of like skills looking at project management, but also like project work and literature searching and critical appraisal and all those other different skills as well, which kind of relate to the 4 pillars of practice. So yeah.
Thanks, Kat. We've got time for one more question. Okay, thank you so much for your time, because this has been great and you're answering questions. But I think you have already mentioned it, but can you just let us know why you chose enhanced practice over advanced practice for your role again?
Absolutely. So, you know, I respect my ACP colleagues, absolutely. But in the area that I work in inpatients, if you go down the route of advanced practice, you really you do lose your identity as an AHP, and so you tend to be more like a medical colleague, if you like. So you will be clerking the patients in, and you will be making those decisions about investigations and therapeutic treatment. And what we mean by therapeutic treatment is it usually means sort of what medical management we are going to give them, not what therapy treatment we're going to give them. And so it does become more of a medical type role. And for some people, that is absolutely what they want to do. But personally, for myself, I felt that I still wanted to keep that aspect of physio, because especially at the level that I am as well, I feel like I can give a lot more to my patients with having those 2 different skill sets of having that enhanced decision making in clinical reasoning, but also having that advanced level of physiotherapy skills as well.
Thank you so much, Kat. I think this is really valuable to hear from people who have done the apprenticeship, because I think there is such a small group of you that have done it from an AHP perspective. And actually, as we keep saying, this isn't a new level of practice, but this is a new opportunity with these apprenticeships to really make an impact for AHPs. And I will say, Kat has also been very kind with her other colleague from UHD in supporting the webinar with NHS England later in the week. So you will also see myself and Kat and a colleague on that webinar talking about the ECP apprenticeship and the benefits it's brought for both Kat and the other colleague as well, but also their organisations, because this is really important. It's twofold, the benefits here. Well, it's actually threefold. There's a benefit here for the individual, there's a benefit for the organisation, and then at the heart of everything we do is the benefit for the patient, the service user, and actually from a safety and quality perspective moving forwards. So thank you so much, Kat. That's been really, really useful. And we will share Kat's slides as well. Thank you, Kat, so much.
All right, thank you.